Hello, everyone. Today's education is over two-way conversations during healthcare appointments. This presentation was created by Sarah Baker, our current vice chair on the board at American Stroke Foundation. Sarah is a healthcare provider, a speech-language pathologist who has worked with individuals who have had a stroke for 30 plus years. She has been an administrator and manager of physical rehabilitation programs for 20 plus years. And she has lots of opportunities to participate in and observe communication interactions that have been great, and also ones that have failed. What this presentation will cover: what are the different ways we communicate? Why does communication break down? Why does it break down with our healthcare providers, or HCPs? What we as patients can do about this, and the use of telehealth appointments during the current COVID-19 pandemic and going forward. A lot of what I will be referencing is related to physicians, but we can experience communication breakdowns with other HCPs like nurses and therapists, and anyone we interact with our daily lives, such as friends, family, teachers, etc. The techniques covered apply to and can be used in most situations. Why is this an important topic? When our healthcare communications break down, we might not share needed information with the HCP so they can make an accurate diagnosis and best determine our treatment, or we might not understand the HCP's advice and their plan for our care, or we might decide to not follow the HCP's advice and plan for our care. If hospitalized, our time in the hospital may be longer than needed, or our healthcare costs may increase, or the quality of our healthcare may be reduced, or we may be unsatisfied with our healthcare. Why is this? Quotes from patients regarding communication breakdown. My doctor doesn't treat me like a person. My doctor doesn't listen to what I have to say. He doesn't believe me. She just tells me what to do. Doctors don't believe me. I know it's real. There must be something wrong. They really don't know what I'm going through. Why would we say these types of things about our HCPs? It's very likely because the communication between patients and HCPs has broken down. There are 3 channels of communication in each face-to-face interaction. We have verbal, which is the words we use, para-linguistic, which are the tone, volume, pitch, speed of our voice, and nonverbal, including eye contact, body language, facial expressions, gestures, how close we stand to each other, and posture. Is one of these more important than the other? It's often seen quoted that 55% of communication is nonverbal and body language. 38% of communication is tone, pitch, volume of voice. Only 7% of communication is the actual words we use. But does this apply to all interactions? Those percentages were developed while researching only one specific aspect of communication in 1967, evaluating what happens when the verbal and nonverbal channels do not match. I would contend that all come into play for successful face-to-face communication. We need to be aware that at times something can interfere with one or all of the channels so that the verbal, paralinguistic, and nonverbal channels may contradict or appear to each other. For example, verbally, someone tells you they are really interested in what you have to say. Non-verbally, their arms are crossed over their chest. What does this mean? Do their crossed arms mean that they really are not interested, or do their crossed arms mean they're just feeling cold? When we experience such interference or contradictions between the channels, we need to pay close attention to the communication interaction and maybe ask questions of the speaker or ourselves to be sure we understand clearly. Examples of communication breakdown during healthcare appointments. For example, nonverbal. The HCP is looking at the computer and not looking at us or not facing us. We might think they're not listening to me, not paying attention to me, or not interested in me. Paralinguistic. Voice is loud, questions are abrupt. We might think, are you mad at me? Are you annoyed with me? Do you really care about me? Verbal examples include the use of medical jargon, uses the wrong name, or tells us not to worry. We might think, I guess I don't understand my needs, they don't care for me as a person, and my concerns aren't important. Why we are interrupted or interrupted when speaking. The interrupter may have an unintentional desire to be supportive, want to show they understand your point of view, want to build a rapport with you by making positive affirmations like I completely understand, or by sharing their own story and experiences, or not understand what you're saying and needs clarification, or not have expected to hear what you said and needs clarifications, or wants to show they are knowledgeable about the topic. The interrupter may have a need to feel like they belong, to be a part of the conversation, but there are no breaks in the conversation. Or they may be afraid they are going to forget what they wanted to say, stemming from impatience, nervousness, or having a thought or idea they wanted to share immediately. The interrupter may also be feeling time pressures, or they may have grown up in, been educated in, or work in a culture where interrupting is common, or have a general lack of self awareness that they are interrupting you. What the research tells us: HCPs aren't always aware of the breakdowns in communication during appointments. Sometimes patients are not satisfied with communication during an appointment, even when physicians feel it was adequate or excellent. One study of orthopedic surgeons found that while they believed their communication was satisfactory with their patients, only 21% of the patients believed the same. But are we good communicators ourselves? Most of us think we are good communicators, but sometimes we can be surprised because the reaction of the person we are talking to isn't what we expected. For example, they use an angry or negative tone of voice in response to us, the conversation took a turn we didn't expect, or they responded defensively. Since we were caught off guard by these reactions, we often think something must be wrong with the other person. But maybe we don't pay attention to our own verbal, nonverbal, and para-linguistic communications, and they were contradicting each other. Maybe one of us experienced a setting event prior to when we started talking. A setting event are things that happen prior to an interaction with others that impact our mood, patience, and tolerance. For example, having an argument with your spouse or getting a speeding ticket on the way to work. And we are still feeling the emotions from those events, and they impact the way we react during a conversation that is completely unrelated and on a different topic. There are many reasons why communication can break down during our appointments with our HCPs. It's important to remember that having good communication skills are not a training program admission requirement for most healthcare professionals. There are also time limitations. Doctors are scheduled to see each appointment for a certain amount of time, but if unexpected things come up, the appointment runs longer, and then the appointment schedule runs behind. And technology. Entering in your computer record during your appointment may be more efficient, but that device can be a barrier for the patient. Telehealth sessions impacted by internet speed, lack of nonverbal cues if over the phone, if there isn't technical support to deal with a bad or no connection or no one to support the patient. Medical terminology, the language HCPs use for accuracy, is another thing that can break down communication during an appointment. However, the HCP may assume we understand those terms unless we indicate otherwise. It's also important to consider, unless they specialize in this area, HCPs may be uncomfortable with or unsure how to address emotional or social issues. Most of the time spent in training is focused on physical issues. HCPs experience normal human issues like stress, fatigue, or setting events that can impact their communication. Because of setting events or the nonverbal communication patients may unintentionally use, the HCP may react negatively to what they think is a confrontational or argumentative patient. However, it's important to remember our HCPs are becoming more and more aware of these and are working how to improve their skills. You have just listened to part 1 of this presentation. Stay tuned to learn more about telehealth and how we can effectively communicate with our HCP.